So anytime you talk about monitoring of technology and those types of things, you have to think about the therapy that goes along with it. So when we talk about oxygen, we need to talk about oxygen itself, the therapeutic effects of it. So the pros, for example, it's been shown to save lives, increase pulmonary blood flow, prevent pulmonary hypertension in our neonates and those types of things, lowers pulmonary vascular resistance, closes the PDA in some neonates. But the con of it, unfortunately, is that it can produce oxygen-free radicals, is associated with retinopathy or prematurity, has been shown to increase admissions and length of stay, and contributes to chronic lung disease because the lungs just don't grow that well in high FiO2s. This is an example of an animal model in which they were exposed to lots of oxygen, so 95% oxygen for 6 days, and showed the difference between room air and 95%. And you can see at the bottom right-hand side that the alveolus actually breaks down throughout that process and shows you that oxygen is quite damaging to the lung itself. When we talk about oxygen, probably the biggest problem is oxygen-free radicals. What are free radicals? Molecules with an extra electron in their outer ring. They are toxic to living tissues. Why do oxygen-free radicals exist a lot of times? It's because our bodies aren't quite efficient enough, and so a lot of times when we're burning oxygen and those types of things, we produce water and CO2 and those types of things, and so oxygen-free radicals then exist. When we talk about oxygen-free radicals, there's several there on the left-hand side, and then there's antioxidants that also battle those oxygen-free radicals a lot of times. And unfortunately, in our preterm infants, they don't have a lot of antioxidants. They don't get them from their mother until later in term, and so when they're premature, they don't get those antioxidants. And so that can contribute to BPD and ROP when you expose them to oxygen therapy.